Welcome to the deep dive. You know that feeling when you really want to understand something important, like how our modern hospitals are designed, but the thought of sifting through endless reports, well, it just makes your head spin. Well, that's precisely why we're here. Today, we're taking a deep dive into the fascinating evolution of modern hospital architecture, just for you.
That's right. And you've given us a fantastic stack of material to work with. Articles from Healthcare 360 magazine, info from Supremediq Consultancy, some great insights from the Building the Hospital of Tomorrow podcast, and perspectives from Torgerson Design Partners, too.
Right.
Our mission really is to pull out the most significant trends, the biggest innovations shaping these vital community spaces. We want to understand their real impact and maybe, share a few surprising facts along the way. Just clear understanding, no dense jargon.
Okay, let's unpack this. Looking at everything you've shared, it's really clear that the whole thinking behind hospital architecture has shifted quite dramatically. One of the biggest changes that jumps out is this core idea of patient-centered design. It's more than just making things look nice, isn't it?
Oh, absolutely. What's truly transformative here is a fundamental realignment of priorities. It's about putting the patient's complete well-being, their physical comfort, their emotional needs, their psychological state right at the very heart of the design process, from start to finish.
So how does that actually look in practice?
Well, it translates into very tangible design choices. Think about the layout of patient rooms, for instance. The main goal is to maximize comfort, make sure there's privacy, and give patients a sense of control over their environment.
Right. So the trend is moving away from those big open wards towards more private rooms. What's driving that shift? Why is it so significant?
Well, there are several key reasons. Practically speaking, private rooms dramatically cut down the risk of infection spreading between patients. That's huge. But beyond that, they offer something really invaluable. A sense of personal space, dignity, which is so important when someone's feeling vulnerable, unwell. It just fosters a more personalized, healing atmosphere. And this patient-centered idea, it isn't just the rooms. Even waiting areas are being reimagined.
How so?
Trying to minimize that feeling of being lost in a crowded, sterile, clinical space. Make it calmer, less stressful from the moment you walk in.
And it seems something as basic as natural light can have a massive effect. The Building the Hospital of Tomorrow podcast mentioned a really striking finding. Hospitals that deliberately included lots of natural light and access to green spaces actually reported higher patient satisfaction and even quicker recovery times. That's quite something.
It really is. And if we connect this to the broader philosophy, it strongly backs up the idea of creating truly therapeutic environments. Research suggests natural light can improve mood, help regulate our body's sleep-wake cycles, which are vital for getting better.
Yeah, makes sense.
And similarly, using calming color palettes, effective soundproofing. It all adds up to a more tranquil, restorative setting.
Makes perfect sense. Okay, another key trend that keeps popping up in our sources is flexibility and adaptability. It feels like hospitals almost need crystal balls these days, designed to handle whatever the future might bring.
Precisely. I mean, the healthcare landscape is constantly changing. We see incredibly rapid advancements in medical tech, shifts in patient demographics, even, unforeseen public health crises that can suddenly stretch resources thin.
Yeah, absolutely.
So because of this, modern hospital design really emphasizes things like flexible floor plans, using modular construction techniques, and making sure the underlying infrastructure is adaptable.
Modular construction, that sounds interesting. Tell me more about that.
Yeah, it's quite fascinating. The concept is basically using large pre-built sections. Think of them like big finished blocks that are manufactured off-site to exact specs. Sometimes they even include wiring and plumbing already installed. These are then transported and assembled on the hospital site. And what Supremediq's materials highlighted, which is really insightful, is how this can actually reduce infection risks during the construction phase itself. Fewer people on site, less material handling. It makes the environment safer even before the hospital opens.
That's a really important point. I hadn't considered infection control during the build.
Exactly. Plus, modular can significantly speed up the whole building process, often reduce costs, and definitely minimizes disruption if they're adding on to an existing operational hospital. And those flexible design solutions like modular internal spaces or rooms you can easily reconfigure for different uses. That means hospitals can adapt much more efficiently when needs change.
Okay, that makes a lot of sense for future-proofing. Now, another obvious shift, maybe the most obvious, is the incredible integration of technology. Hospitals are just becoming these incredibly high-tech hubs.
Oh, absolutely. The tech integration isn't just like an add-on feature anymore. It's fundamentally reshaping the architecture itself. We're talking everything from the really sophisticated medical imaging equipment
Mhm.
and robotic surgery suites
Right.
to comprehensive telemedicine platforms and electronic health record systems that need to be seamlessly integrated. Technology is deeply embedded in the structure and the function of these buildings.
And it's not just the big, flashy machinery, is it? I saw mentions of smart patient rooms and IoT-connected devices. What does that mean?
Exactly. Think
Mm.
about smart building systems that automatically adjust lighting and temperature in patient rooms,
Sure.
better comfort, but also energy savings.
Hmm.
Telemedicine rooms are becoming standard, allowing remote consultations, which really expands access to specialists,
Yeah.
and the Internet of Things, everyday medical devices connected to the network, talking to each other and the main systems.
Right, connected devices.
That's becoming huge for continuous patient monitoring and making workflows much smoother for the staffs. AI is even being used in the design phase now, helping optimize layouts or predict future needs.
It's almost like the hospital itself is becoming this responsive, interconnected technological ecosystem. Wild. Okay, this next trend feels particularly crucial today: sustainability and wellness. It's no longer just about the health of the people inside, but also the health of the planet.
Yeah, this really brings up that important point about environmental responsibility. Hospitals are massive consumers of energy and resources, so there's a growing and really essential focus on energy efficiency, minimizing waste, and just generally environmentally conscious design.
So, what does that look like in practice?
Well, green building techniques, incorporating renewable energy sources like solar panels, using sustainable, low-impact building materials.
These are becoming much more standard practice, not just niche ideas.
I even saw rainwater harvesting mentioned in some designs. Exactly. And these sustainable practices, they offer benefits way beyond just helping the environment. They also create healthier indoor environments for patients and staff, think better air quality. And they can lead to really substantial long-term savings in running costs,
Right, lower energy bills.
for sure.
Yeah.
And things like improved air quality and good natural light, which often go hand in hand with sustainable design, they directly link back to better patient well-being too.
It really is all interconnected, isn't it? The final key trend highlighted is community engagement. It's this idea of hospitals being more than just places we go when we're sick.
Yeah, what's really noteworthy here is how the perception of the hospital is evolving. It's being seen more as a vital anchor within its community.
Okay.
And that translates into design choices that prioritize accessibility and inclusivity for everyone in the community. We're seeing things like public spaces integrated into hospital grounds, maybe community gardens, or even facilities for health education and outreach programs. The overall goal is really to foster stronger connections and actively promote health and wellness beyond just treating illness, emphasizing prevention and healthy lifestyles out in the community.
So those are the big picture trends shaping modern hospital architecture. Now let's dive into some of the specific innovations that are actually bringing these trends to life. Evidence-based design sounds really fundamental, like a big shift in approach.
It really is. Instead of just relying on, intuition or maybe how things have always been done, evidence-based design uses hard research findings and data analysis to inform pretty much every aspect of the design.
Can you give an example?
Sure. So for instance, studies that clearly show the negative impact of noise on patients' sleep and recovery. That directly leads architects to choose specific noise-reducing materials or plan layouts differently. Similarly, the well-documented benefits of natural light, that data guides decisions about where windows go, how big they are, in both patient rooms and staff areas. Even choosing ergonomic furniture is based on research into how it affects patient comfort and, just as importantly, the physical health of the staff. It's a much more data-driven, scientifically informed way to create these healing environments.
That sounds much more scientific. Yeah, focused on actual outcomes. And biophilic design, that's the one focused on bringing nature indoors, right?
Exactly. Biophilic design taps into our inherent human need for connection with the natural world, so it intentionally integrates natural elements into the building.
Like plants.
Yeah, it can range from indoor gardens and green roofs to simply making sure rooms and common areas have really good views of nature outside. The core idea is that these connections with nature can genuinely reduce stress, improve mood, and positively contribute to the whole healing process. Features like accessible outdoor courtyards or peaceful rooftop gardens can offer these really valuable retreats for patients, visitors, and staff too.
I love the idea of a rooftop garden in a hospital. Just seems like it would offer such a needed sense of calm. Now, we touched on modular construction earlier as a trend, but it's also listed here as a key innovation. What makes it particularly innovative?
Well, its innovative power lies in its potential to really transform how hospitals are even conceived and built. Using those prefabricated parts allows for much faster construction times, cuts down on site waste and disruption, and often results in lower overall project costs.
Right, the speed and cost.
And standardized modular room layouts can boost efficiency later on. Plus, the controlled factory environment for building these modules can lead to higher quality control. And importantly, modular design usually offers more flexibility for future expansion or reconfiguring spaces, helping hospitals adapt more easily down the road.
And finally, smart building technologies. We mentioned some aspects, but what's the overall impact these integrated technologies are having?
The overarching impact is really about boosting efficiency right across hospital operations, optimizing how the facility is managed, and ultimately improving the patient experience. Things like automated lighting and climate control save energy, yes, but they also create more comfortable, personalized spaces for patients. Real-time location tracking systems can dramatically improve staff workflows, no more hunting for equipment or colleagues. And that growing integration of IoT medical devices allows for continuous patient monitoring, gathering valuable data, leading to more proactive, personalized care. Essentially, smart tech aims for a more responsive, efficient, and patient-focused environment.
So, with all these major trends and really cool innovations, what's the actual real-world impact? It's clearly about more than just having a nice-looking building, right?
Oh, absolutely. The impact is profound, and it hits on multiple levels. We're seeing tangible improvements in patient outcomes. These thoughtfully designed environments genuinely contribute to lower stress levels, faster recovery times, and just higher overall patient satisfaction.
That makes intuitive sense. I mean, if you feel more comfortable and less anxious, it stands to reason you might heal better. What about the impact on the hospital staff, though? They're under immense pressure.
That's such a crucial point. Hospital designs that specifically consider the needs and well-being of the healthcare providers can significantly boost staff productivity and, importantly, job satisfaction. Efficient layouts minimize wasted steps, ergonomic workstations reduce physical strain, and seamless tech integration streamlines their work.
Right.
This can lead to better morale, less burnout, which ultimately, of course, translates back into better patient care.
And it stretches beyond the hospital walls, too, right? Back to that community engagement idea.
Precisely. Hospitals designed intentionally as accessible, welcoming community hubs can play a much bigger role in promoting health overall. By providing easy access to services, offering health education, engaging in outreach, they actively contribute to preventive care and fostering healthier lifestyles in the whole community they serve.
And we definitely can't forget the growing importance of sustainability in all this.
No, indeed. Sustainable hospital architecture has a direct positive impact on the environment. It significantly cuts energy consumption, minimizes waste, lowers harmful emissions. It contributes to a healthier planet and aligns with those broader global sustainable development goals.
This has been incredibly insightful, really painting a picture of the modern hospital. Now, for anyone listening who might be involved in actually owning or planning a hospital, what are some key takeaways or considerations they should really keep in mind based on our discussion and the sources?
Yeah, this is where that specialized expertise from firms like Supremediq Consultancy and Torgerson Design Partners that we looked at becomes so incredibly valuable. Supremediq, for instance, they offer really comprehensive support through the entire hospital project lifecycle, from the very initial concept and planning stages all the way through to day-to-day operations and even achieving accreditation, like from NABH.
So end-to-end support.
Exactly. Their services cover a huge range: hospital design, strategic planning, navigating that complex NABH accreditation process, recruitment, manpower planning, specialized construction like modular OTs, installing medical gas pipelines, procuring all the necessary equipment and furniture. It's extensive.
Wow. Okay. So it sounds like partnering with experienced consultants like that can be a massive advantage. And Torgerson Design Partners really hammered home those patient-centered design principles we discussed earlier.
They absolutely did. Collaborating with healthcare architecture firms who genuinely understand and prioritize patient-centered design is essential if you want to create truly effective healing environments. These specialized firms, they have the knowledge and the experience to translate those core principles, comfort, privacy, accessibility, into the actual physical design.
The Building the Hospital of Tomorrow podcast also flagged some common pitfalls to avoid in hospital design. What were some of those key warnings?
Yeah, one really significant mistake they pointed out was poor space planning. That can just lead to inefficient staff workflows, frustrating bottlenecks for patients moving around, and general operational headaches.
Okay.
Another critical area was neglecting to build in robust infection control measures right from the start, which is obviously paramount in any healthcare setting. And finally, they cautioned against being short-sighted about future scalability. Failing to design with future expansion or adaptation in mind can lead to really significant and costly problems down the road.
That makes total sense. You have to think long-term, anticipate growth and changes in how healthcare is even delivered. And it sounds like there's a really delicate balance to strike in the whole design process.
Exactly. The material from Understanding Patient-Centered Healthcare Architecture really stressed how crucial it is to effectively balance the budget constraints, the functional needs of the hospital, and those core principles of patient-centered design.
It's a juggling act.
It is. It's about making smart, informed decisions, strategically focusing resources on the high-impact design elements, like maximizing natural light, ensuring good privacy, optimizing layouts to get the biggest bang for your buck, the most positive impact, without necessarily breaking the bank on every single detail.
This has been a truly illuminating deep dive into modern hospital architecture. So just to quickly recap, it really feels like the field is fundamentally shifting towards designs that are, well, not just highly functional, but also deeply focused on the holistic well-being of patients and staff. They need the agility to adapt. They need to seamlessly integrate tech, prioritize sustainability, and really recognize the hospital's vital role in the community. And ultimately, this thoughtful, innovative design, it has a real measurable impact on healing, on efficiency, and on the health of our planet.
Exactly. It's about creating spaces that truly support health and well-being in the most complete sense of the word.
So considering all these really remarkable advancements in how we think about and build healthcare spaces, it really makes you wonder, what might the future of personalized, maybe even preventative healthcare spaces look like, maybe beyond the traditional hospital building itself? And what transformative role is technology going to play in extending that healing, wellness-promoting environment far beyond the physical structure? It's definitely a fascinating prospect to mull over.
Indeed. That interconnectedness of smart design, fast-evolving technology, and a deep understanding of community well-being it's undoubtedly shaping the future of healthcare in some truly compelling ways.